Good morning, everyone. Thank you for joining the meeting. Welcome to our presentation this morning on strengthening cybersecurity and health IT. Our company, Science Systems and Applications, was founded in 1977. SSAI is a pioneering organization dedicated to advancing scientific innovation through cutting-edge research and technology. We specialize in various fields, including earth sciences, health IT, cybersecurity, and engineering. Our mission is to empower scientific discovery, technological advancement for the benefit of society. We are excited for today's webinar, and on our panel of speakers today is Eric Davison, Barbara Gray, and Clay Bazard. Please join me in welcoming our speakers. Eric, please introduce yourself.
Yeah, thanks for having me on. Anyways, I did earlier presentation on AI and found it very interesting topic to have a discussion about. But in general, I've been in cybersecurity and IT for about 30 years, as of this month, actually. I've done a lot of government contracting, consulting, working with different organizations for improving their cybersecurity maturity, compliance objectives. I've done work in NOx and SOX. I've done advisory work, and I've also done a lot of work with healthcare organizations as well as state and government on different levels, federal up to TS level type of work. But I started my career in the military. I did 6.5 years in the service. I was a cryptologist, and that's where I kind of got my start in security in general. So I've been doing this for a while, but more focused on the GRC side of house in the last, I'd say, almost 10 years. But yeah, thank you.
Thank you, Eric. Barbara, please introduce yourself.
Barbara Gray, President and CEO, Gray Matters Technology Services. We've got about 20 years in and around cybersecurity, now AI, machine learning as well. We have an IT health division. We're a small woman veteran-owned firm out of Bowie, Maryland, that serves in about 10 different agencies today. We primarily focus on risk management framework, ethical hacking, pen testers. We're end-to-end PCI DSS compliance auditors, as well as enterprise audit, as well as an enterprise auditing firm. So we have quite a bit of cybersecurity experience. I am a certified enterprise architect, and I've been in and around information technology for probably 30, 40 years. And thank you for allowing me to be a part of the panel.
Thank you, Barbara. It's always a pleasure to have you. Clay, please introduce yourself.
Yes, good morning, everyone. My name is Clay Bozard. I'm the Chief Innovation and Growth Officer for 3 Reasons Consulting. 3 Reasons is a service-disabled veteran-owned and woman-owned small business focusing on cyber services for DHA, DoD, Department of Navy, VA, etc. My background have been around 28 years in health IT, most of which was on the civilian side, but it did start in military. I was a CIO for Ireland Army Community Hospital in Fort Knox, and then VP of IT for IDN in Western New York, where I actually reside, and then a CIO and CISO for a large group of nursing homes throughout the Northeast, and been in GovCon for just a little bit over a year, but a lot of health IT, CIO, CISO level experience. So happy to be here, and thanks for having me.
Thank you so much. So we will get started with our presentation. I'll transition the presentation over to Eric at this time. Thank you, Eric.
Yeah, thank you. Glad to be a part of this discussion. Hopefully everybody gets something out of it or finds something interesting. But anyway, so, one of the things we want to talk about today is cybersecurity in the world of healthcare. Why does it matter? What are some of the things that we need to consider? And, I think in the healthcare environment, typically the things that we're most concerned of is availability, especially for those critical healthcare systems. Preservation of life is always going to be first and foremost, but also a big concern, especially with the advent of so many different technologies in the world today, and people trying to exploit information in terms of trying to gain monetary gain. There's a lot of things that organizations are looking to do, especially from the healthcare perspective, to protect that data and information and patient data privacy, that confidentiality aspect of it, so to speak. But some of the things that you could probably think of generally are, protecting that sensitive information, especially PHI and electronic healthcare records, things of that nature, unauthorized access. There's obviously cybersecurity measures that will, prevent individuals from accessing or stealing that PI, but it's all about a defense in depth strategy, incorporating not just all of the technologies, but those administrative things as well from a people perspective, and making sure that people, exercise the right habits. The IT departments understand the risk. They do all the, measures to protect the data at risk and in transit. And then there's the, ethical responsibility aspect of it, doing the right thing and using due care and due diligence, making sure that, best practices are followed and people's data is respected. From a regulatory compliance perspective, of course, you got HIPAA, high tech, high trusts, possibly GDPR and other things like that. There can be some severe implications in terms of cost and fines related to that. I believe in 2018 Anthem, they had to settle. I think there was a settlement for $115 million for victims that had their data, I guess, exfiltrated. So there was that lawsuit, plus Anthem had to pay a penalty of $60 million to the U.S. Department of Health and Human Services and the Civil Office for Civil Rights. So obviously, from that perspective, there can be some big cost implications in terms of fines and fees, and also loss of reputation. You don't want people to, people already have an inherent distrust of some organizations and their data, and they're very apprehensive to work with some people, especially providing the healthcare information. So as an organization, you want to make sure that you do the best you can to protect that. There can also be operational disruptions. If you think about what could possibly happen with ransomware, we'll go in a little more detail in that, but obviously if you lose a lot of that information, there can be very important details that doctors and healthcare physicians rely on to make sure they exercise the right care for their patients. So that's always critical. The continuity of care, operational integrity, patient safety, of course, like I said before, going back to the availability aspect, if a system is suffers some kind of attack, especially if you think of something along the lines of a denial of service or distributed denial of service, then there could be some significant losses there in terms of loss of life, or other aspects of people's health, because today, now with the advent of so many technologies that are involved in analyzing data for their health, or keeping certain life support systems on, etc. So that there's always multiple aspects to consider whenever you're thinking about a healthcare environment and what's important to the professionals that work in there. And then, like I said before, there's a lot of IoT, IIoT, so many devices that are interconnected, Wi-Fi. There's so many new avenues, especially from a supply chain perspective, that people can manipulate to gain access to a system, even as something as innocuous as like a thermostat for an aquarium or something along those lines. If they're able to infiltrate your system, if there's a weakness, or if something comes from a country, an area where there's certainly supply chain risk. There's always an advent for that, for them to exploit those avenues. So always be aware of those as well. Make sure you're doing that security, especially mobile device management. Nowadays, a lot of that stuff can be integrated with network access control technologies, like something along the lines of like a Force Scout apparatus or appliance, to make sure that there's not, people aren't arbitrarily connecting into parts of the network and doing some damage from that aspect. So there's a lot of things to consider there. The data integrity and accuracy of information, making sure that that information can't be erroneously altered for nefarious purposes. Of course, that can lead to some really scary healthcare stuff. If you can imagine, if somebody was altering, or if healthcare records got altered and somebody made the wrong assumption about the blood type, or maybe those records were altered, then that could be critical to some people, especially if you had people getting a transfusion, or if they were supposed to do surgery on one side of somebody's body. You always hear of these scary things. The wrong body part or wrong leg was operated on or even removed in some situations. So I mean, these are worst case scenarios, but these are things that could definitely happen if healthcare records were altered, or changed in a way that without healthcare physicians being aware of. Third party requirements, vendor management. Think of all of the software and tools that healthcare organizations use, even as something as simple as a USB device, or a certain key. Where does it come from? If the country of origin is North Korea or China or someplace like that, then there could be malicious code on that, or it could be an avenue for somebody to plug it into a device that's managed on the healthcare network and cause a lot of problems. So part of that is going to be training from a healthcare perspective within the organization, letting them be aware of risk, and maybe even tightening things down from an IT perspective to make sure that people don't practice habits that introduce that type of risk. And then, of course, some of the other things would be like the data, the availability of the data, especially from a backup perspective. Now with people trying to manipulate, the data, or keeping people from having access to data in the form of a ransomware attack, you want to make sure that you have a backup. A lot of organizations don't have good backup practices, and then it bites them on the rear whenever they have a ransomware attack and they don't have anything to fall back on, or the data that they backed up was so old that it's not viable for a lot of reasons or another. There's been even legal organizations and the police have had their information lost from a ransomware attack. They didn't have adequate backups, and for that they suffered pretty greatly and ended up paying millions of dollars to some nefarious group of people. From a key threats of healthcare, that I think one of the biggest things here is, like I said before, people are money driven. Of course, healthcare information is very sensitive, so one of the most prevalent ways for people to take advantage of that is through a ransomware attack. You got data encryption and extortion, sometimes something called double and triple extortion. They might even get the money and then go after the actual individuals that had their information exposed. So not only can they go after the healthcare organization, but they can also threaten those people that are trying to protect their information. If you could imagine, if there was like a CEO of a company and he was well known with that company, but he didn't want people to know about his impending cancer or care, because he might worry about the overall stock of the company, or people worrying, and then the information got out, that can definitely hurt a company from at a corporate level in terms of their market share, or what the value of their company is. So there's a lot of different reasons why healthcare information can be important to protect. There's the phishing and social engineering aspects. Like I said, you can have all the technologies in the world, you can have things tightened down properly, but if people aren't adequately trained and aware of certain threats, then they can definitely introduce threats into the environment, either on purpose or involuntarily on accident. It happens all the time. Spear phishing, whaling. The certain executives now. This environment is so chaotic, and there's so many different technologies people can leverage, even deepfake technology, which is pretty scary nowadays, to make people assume that they're representing a company or a senior official asking for payments or other things like that. There should always be a red flag if anybody on an email is asking for payments or an ACH transfer. That there should be automatic red flags, and like triple check if there was a purchase made, or if money was to be transferred or exchanged. Don't take any of those things lightly, no matter how realistic they look. It helps to not only sometimes make a phone call, but if you're available, actually talk to the person that supposedly said what they said. All that threats from malicious insiders, negligent insiders. So you have the insiders that are purposely doing things inside of the organization. Be aware, understand what behaviors are, negligent, or just people that are making mistakes. They're not paying attention. They're due care, due diligence. Be aware of those things as well. In OWASP Top 10, which is the threat model, misconfiguration is a very common and major concern in terms of threats. So, do your training at a corporate level. Don't take it lightly. Make sure everybody from, the ground up to the top has adequate training. They're aware of risk. Data breaches, theft of protected information. Like I said, you might have different aspects of your organization that are harmed from your reputation. People lose trust in you. It can also hurt in share prices, corporate, their perspective in terms of, what's important to them. People may not want to work with them also from a third party perspective because they're worried about their data getting leaked, or they don't trust how people are going to manage their clients or customers as well. So there's that aspect. And then the sensitive data exposure where, PHI or health records, things of that nature get leaked out. You can have, major fines and payouts, litigation, not only to the patients, but also to governing bodies or government in millions of dollars. So that's thing. And then advanced persistent threats, a lot of them will get through, they'll find the path of least resistance, which is, going to be your social engineering type of attacks. Once they get in, they'll be very subvert, and they're very patient. State actors or sophisticated organizations have the means to infiltrate very sophisticated attacks, and they work laterally. So once they're in the system, a lot of times they're not in a rush to do anything. They're just going from file to file or system to system, doing as much reconnaissance as they can and finding as much data as they can. So a lot of organizations, I think the typical APT threat will exist in a system for somewhere between 12 and 18 months, sometimes even longer. So you imagine if there was, an attacker that had the inside on your system, how much information they could gain and how much they could learn about your defenses in a period of, 1 to 2 years. You can imagine that'd be pretty significant. So their attacks can be anywhere from simple to very sophisticated in terms of the technology that they're using, and methods that they're trying to access the systems. And a big problem for healthcare organizations too is not updating their systems. You have a lot of systems that aren't kept up with. You have EOL or EOS, which is end of life, end of support. Once it gets to that stage, it should be considered a critical item, because whenever you lose that or when you get to that end of support stage, you don't get those critical updates. You don't have security updates. Things aren't kept up, and then you introduce holes into your system that attackers will gladly exploit because you didn't make sure that those systems were up to date, maintained, and vetted from a risk perspective. So if you have EOL or EOS, make sure that there's a plan to migrate away from those legacy technologies or things that aren't updated. Cloud security threats and misconfigured cloud services, incorrect settings. The cloud's great, but just because you use the cloud doesn't mean you're not going to have any problems. You still have to practice security. You still have to make sure that the settings are appropriate to the impact level of the data that you're trying to protect. Shared responsibility, it's a thing. If you're not familiar with shared responsibility in terms of you as the customer or organization in the cloud, definitely be aware of it. A lot of cloud services will gladly discuss that with you and let you know what the expectation is from your end and what they do from their end. And there's different responsibilities from different models, from IS, PaaS or PaaS, platform as a service, and infrastructure as a service. So depending on what you're doing, there's going to be more responsibility from your perspective in terms of how you manage what the cloud is providing you. And then, like we said before, misconfiguration is a big thing. That's human error and lack of training. So do the training, because that's going to prevent deficiencies, such as weak password practices. Hopefully there's some complexity, but nowadays, according to NIST, it's better to have a long phrase than it is to have a bunch of numbers or a handful of numbers and symbols. Something that's unique to somebody and memorable that's long is more useful than a very complex combination of symbols and letters and numbers. So keep that in mind. Longer is better when it comes to password passphrases. Mobile devices, we covered that a little bit. There's a lot of bring your own device in a hospital. There's lots of visitors. That's just the way it is, especially at the facility. So tracking those capabilities using mobile device management, being aware of lost or stolen devices, especially if it's managed from your organizational perspective, make sure that practices are followed from an incident response, and treat it like an incident. It doesn't mean it's a data leakage, but you lost a key asset or a device. It should be hopefully disabled or remotely wiped, depending on what kind of device it is, so an attacker can't use that, to access data. And then, of course, unsecured Wi-Fi networks. Some of those things need to be, managed, especially from a customer perspective. There should be certain, security measures in place that provide some level of encryption, especially for people that work within the organization. And then, of course, separating that from people that are, visiting, so to speak. They should have access, but definitely not to the network. So this is an interesting one. For people that aren't familiar with zero trust architecture, think of like the old paradigm, which was like you had a hardened castle. So you had this, hardened perimeter, like nobody can get in, and limited, egress traffic, kind of like a castle. But now with zero trust, it's like, okay, each room in the castle is protected. So really, zero trust is protecting the resource versus the perimeter. It's kind of a paradigm shift in the way that organizations are trying to protect their key assets and resources. And for healthcare organizations, data is a huge thing. So if you have different systems, different types of data, maybe you have a place where certain data is stored for your radiology, or your diagrams, or results from CAT scans, PET scans, etc. They might be one place. You might have other information, on customers in another place, healthcare records. All of those will have protection mechanisms in place for that access in the form of policy enforcement points. You don't really have to know too much about zero trust is protecting the resource. It makes it a lot harder for advanced persistent threats. So zero trust is a great tool. Very few government organizations I've worked with or talked to have actually done it. A lot of people are in the phase of doing it. Of course, there's Executive Order 14028 and a handful of others that are really pushing for people to do this, because it will definitely improve security within an organization. For AI and machine learning and threat detection, I covered a lot of this in the previous discussion, but AI is really great because, like I said before, people make mistakes all the time. AI is not perfect, but AI doesn't get tired. AI doesn't get distracted. It really can take a lot of information that humans can't do with the naked eye, and come up with correlation and analysis of that data. It can determine, if there's something nefarious going on that might look innocuous to the naked eye. It can help people working at a SOC, determine if there is a bigger threat going on or a potential threat going on. Sometimes there may be false positives, but at least giving that insight to the security workers within the organization to kind of understand what's going on at a macro and micro level within the organization, and integrating some of that determination or that behavioral analysis with all of the information that you could think of, like a SIM tool would provide. like Splunk, for instance. It's gathering thousands and if not millions and millions of log pieces of log data from all different sources. Like, how do you correlate that? How do you come up with a response or analysis in a short time? AI is a way to help people make sense of that information, and it can also be used to automate tasks. Like I said before, once AI is doing a certain function or task, it usually does it very cookie cutter. It doesn't deviate from that information. So, like I said before, it can help prevent a lot of mistakes. But like I said before, a lot of research has to be done, and it should also be checked as well, because I've seen AI make mistakes. It is getting better rapidly, and the generative AI and either other applications from it are just getting exponentially better. But it helps to be an expert in whatever field that you're in to do a cursory check and say, okay, that makes sense, because it'll do a lot of the grunt work for even like billing to healthcare analysis, and its implications in terms of what it can do with gene code analysis and all this other stuff is fantastic. But do some check whenever you're using that. Cloud and blockchain security. From a security perspective, blockchain has some pretty interesting uses. Immutability is one of them. Once data is recorded, on a blockchain, it cannot be altered. Blockchain is kind of an interesting technology in that it can preserve data or keep it from being altered or deleted. Going back to what I was talking about earlier, that could be a very important aspect for healthcare records, and making sure they're not tampered with or fraudulently manipulated. So that there's that aspect. Transparency provides a ledger more or less of all transactions. It allows for easier tracking and auditing of data, which can help with the identifying and mitigating security breaches a little bit quicker. The encryption aspect of it uses more advanced cryptography techniques to secure the data as well. From a confidentiality perspective, that's very important. Each block in the chain is more or less encrypted and linked to a previous block, and that ensures that data is protected from unauthorized access. So that's some pretty cool stuff. And I think from a contract perspective, it can help with executing contracts with the terms directly written in the code. So that can make things a little bit easier for an organization to manage as well, and save a lot of time and reduce the risk of human error and malicious manipulation. So whether it's purposely nefarious or accidental, it can definitely help with that aspect. And even also the management of those healthcare records. Identity management, blockchain can enhance the identity verification by providing a secure and more of a decentralized way to manage the digital identity. So that could be something going forward that I think a lot of organizations will look forward to, because identity access management is just becoming bigger and bigger. I think is pretty cool stuff. This one's pretty interesting. Quantum computing, the traditional computing measures, as most people think, are like ones and zeros or binary bits. Kind of goes a step further in the randomization processes, and they use something called quantum bits or qubits, which they exist in multiple states simultaneously due to their superposition. So it's almost kind of like a randomization, instead of like different coins, heads or tails. Imagine all of them spinning, and they're just constant randomness. I think that that process is what allows it to be more exponentially difficult to break or hack from a security perspective. It offers a lot in the realm of security for organizations. It uses quantum mechanics in theory to encrypt data in a way that is, theoretically unbreakable from a normal computing perspective. So, somebody to really crack quantum code or encryption would probably need a very, very powerful series of computers, not just one or two or three, but possibly close to a data center at this time. Maybe computers will evolve to where there'll be something in the future beyond that. But right now, it's pretty powerful. It also allows for sharing of encryption keys between parties. That's useful, and any attempt to eavesdrops on a key exchange will alter the quantum state of that process and very greatly mitigate a potential breach, just because it's so hard to jump in there from an eavesdropping perspective or man in the middle attack. It would take something a lot more advanced than your typical means. Attackers are typically going to take the path of least resistance. So no system or process is full safe, but if your system is very difficult to access or break or breach, chances are they're going to go somewhere else that's easier. That's just the way people work. Hospitals and clinics can also use it to securely transmit data. So not only, protecting that data from records, but, if they're transmitting it, it will also be very hard for, bad actors to get access to that data as well. There's like I said before, there's the true randomness of it. I think the term is QRNG, or quantum random number generation, and that goes back to the states of those, the zeros and ones of that information. The quantum computers can generate truly random numbers, which makes the encryption process a lot more difficult. I'm not a encryption or quantum expert. Very few people are, but just knowing that, hey, it's a lot more advanced. It makes things a lot more difficult. It protects data, whether it's in transit or rest, is why it's an interesting technology to look into. And there's some companies out there that are actually making this technology more available and to a broader perspective of potential organizations beyond just the government agencies that have the huge budgets. There's improved threat detection, advanced analytics. We talked about before how AI can help with that. We already know about machine learning and certain tools like I said, SIM tools, or security incident events management devices. They can make that correlation analysis. Quantum computing can process amounts of data quickly, so it can even take things up to the next level in terms of identifying patterns and anomalies indicative of cyber threats. So like I said, you could have thousands of pieces of information. How do we make sense of that? Like, what's really going on? Quantum computing, AI, those type of technologies can make that data easily assimilated and understandable to a security team to produce an action to mitigate potential harm to the organization. Proactive defense, early detection, and real-time monitoring. I think that is an enabler for security for the organizations. With quantum computing, things move faster. If an organization or a healthcare organization harnesses that technology, they're going to be that much more proficient at not only protecting their data, but being able to isolate them and mitigate them as well. And then another cool aspect is like telemedicine and remote care. Some of these things are growing rapidly now. I see it all the time for different things, from hormone replacement therapies to other types of meds that people are now able to access a lot quicker in the data exchange where that information has to go, because a lot of these telemedicine providers, they still require sensitive information. So how do we protect that? That's one of the ways that it can be done as well. And it also can help an organization meet their compliance requirements in terms of demonstrating that they're doing the adequate or above the adequate measure to protect that data and information. And then, of course, the data integrity verification, digital signatures, that ensures that data is not tampered with, right? That what's being produced and sent is the same information. It hasn't been altered. It hasn't been changed in any way that could be harmful to the patient or the organization that's handling that data. And then, of course, an audit trail, assisting in creating secure and those verifiable logs for compliance audits. So somebody goes and says, okay, did you do this, when and how? All that information is there, which can help with the audit process, especially for a healthcare organization that's looking to demonstrate that they're doing the adequate means of protection for the organization. And then resilience against future threats. The technology is advancing so fast. Quantum computing becomes more accessible. It could be used maliciously to break current encryption methods. So staying ahead of that curve, staying up to date, and using whatever technologies are viable for an organization to protect against threat actors that are advancing as well. So it's always going to be a cat and mouse game. But like I said before, the more you practice security, the more you implement sound technologies, the less likely it is that attackers are going to find it worthwhile from a cost and time perspective to try to infiltrate your system, exfiltrate your data, and introduce some kind of means to extort or get money from your organization. 5G and IoT, I'm not going to go too deep in that because I kind of touch on that a lot. But think of the availability now of high-speed information anywhere on mobile devices, and IoT, which is Internet of Things, anything from thermostats to healthcare devices, other electronic devices that are either attached to people or monitor their information to provide insights and to better take care of themselves, or a potential health scare. There's a lot of IoT that's going to be that is it's just going to proliferate in the medical environment because it makes things so much easier to manage and quicker to access. So there's a need to protect that information. There's a lot more of these connected devices, which, like the slide says, it increases the attack surface. So there's now more opportunities than ever for a bad actor to find an avenue to gain access to a system. So I think that's why we need to be constantly aware of that, and those things need to be implemented. And especially for a healthcare organization where so many visitors come in and out of a hospital constantly, there's not that same level that you might find from like a secure government facility where it's a little bit harder to go in and out. There's some cursory security means, but hospitals need to be a little more diligent. Biometric authentication and privacy enhancing technologies. This stuff's really cool. Some of the stuff you probably heard of, some maybe not. There's touchless fingerprint scanners in the mix or on the horizon. That's going to prevent pathogen transfer. People won't have to directly contact systems as much. And I know for some of you that have done palm scans, fingerprints, sometimes it can be a tedious process. There can be a lot of wiping, or the scans, the glass isn't clean enough or whatever. This technology will improve. It'll also, like I said, help things be done more quicker. It reduces hygiene concerns. Ultrasonic fingerprint sensors as well that can create 3D images of fingerprints that can improve the accuracy, even with whether they're wet or dirty. Like I said before, wiping fingers and glass, people might not, might get the wrong information on that, or get like a false negative on their biometrics. So that's a good way to do that. There's also 3D facial recognition, which goes a step further beyond the traditional two-dimensional methods by capturing the depth of information, enhancing the detail to get a real accurate scan and make it that much better in terms of providing security. And then mask detection algorithms. A lot of organizations have people still come in with a mask, or if they're sick, they're covering their face. It can read enough information using some advanced algorithms and come up with an analysis to make out who they are. That's probably a little bit further down the road, but it's something on the horizon. Iris and retinal scanning, of course, you've seen before. It'll just become more proficient. Some of you have already seen that at like those TSA clear lines or in the airports. It'll be like that or better, but it's hard to reproduce a retina scan, because people have unique patterns of the capillaries in their eyes and their retina. It's very hard to duplicate, but that doesn't mean the technology is perfect yet. Enhanced imaging techniques, infrared imaging, can be used. People have their own signatures in terms of what that image might look like. Contactless scanning, palm vein authentication. So instead of just using basically what the dimensions are of the palm, it can go a step further and look at the veins within the hands, and come up with that for biometric authentication. Language, voice recognition, and also the technology to prevent deep fakes. So like I said before, deep fakes to us, to the human ear, can sound very realistic, can sound just like somebody, but it'll have a pattern, in terms of the technology and the way it's being digitized, that won't be human like. There's always going to be, like I said, the cat and mouse game of which technology is better. How do we prevent these threats? How do we verify if it's somebody's voice or not? So these are some of the things that technology is trying to help us with, and prevent those threats. The challenges overall are going to be, I think, the APTs. Ransomware is going to stay prevalent. There's going to be no let up on that. People are money driven, especially bad actors, and they're going to go for the way that's going to get them the most money. And typically encrypting your data, making it inaccessible, and then charging you a huge amount of money to have access to that data is painful. And then also they can threaten the release of that information as well. You don't want the information they have also to be leaked out if, let's say, they're mad or they're vindictive for some reason. Anything can happen when you're dealing with a bad actor. But being ready for AI and that constant battle, because people will use it, especially when now we're talking about deep fakes. How do we recognize it? What technologies do we use to verify something is real or not? IoT and medical devices, we talked about that. More attack surface area. We got all these devices on our palm, on our wrist, the watches. People wear necklaces now that can monitor a number of different things. So with all of that IoT, there's a lot more potential for organizations to miss something, and then a bad actor to exploit that. So there's that. And then there's device management complexity. With a vast array of devices and different operating systems, security capabilities is a significant challenge. And a lot of times organizations and healthcare organizations do this as well. They throw a lot of technology when they don't really have to. And now you got all of these devices, these new systems, and they might be really cool in terms of what they can do, but if they're not managed properly, then they introduce new security threats. So if you do use something, if you do use a new technology, make sure that it's hardened and your resources are managing it properly. Just don't try to be one of those organizations that are tools rich, capabilities poor. It's better to have a few things that work really good than a whole lot of things that are cool but aren't really managed too well. So keep that in mind. Balance accessibility and security. As a healthcare organization, you have to have access to your data. You want to make sure that it's protected, but you don't want to do it in a way that's cumbersome and hindering usability of that data. Healthcare professionals need that information, so work with them in terms of, are they having the experience that they need to have with that data? So there has to be a balance there. There is the regulatory landscape to consider, compliance complexity, and a lot of organizations have multiple things to consider. So vet that from the top down, be aware of the risk, what type of data you're using, and also the systems that house that data and how they protect that data. So keeping up to date on those, using good patch management processes, having a change and configuration management process that multiple stakeholders are aware and in tune with, what's being changed across the enterprise. That's important from a governance aspect. And then lastly, I'll say, the integration of emerging technologies, the AI, the cloud computing, the quantum computing, there the longer term approach is, looking and staying up to date and keeping employees trained, having a cyber staff that is up to date on the latest technologies and well trained on those potential threats. And then also, really closely vetting technology like AI and using its vast capabilities. Different models are out there, different systems, capabilities, cloud services. Make sure you do a lot of research before selecting those, but they can be beneficial technologies in reducing your risk and also analyzing threats and what's going on within your enterprise.
Thank you so much for your presentation. Okay, now we're going to move on to our panel discussion. And we will start with our first question, and I will address it to Barbara. How will AI reshape cybersecurity in the healthcare system and also within the government agencies?
So I think Eric touched on quite many topics relative to cybersecurity and IT health. But I think one of the things that's going to reshape it is going to be the next generation machine learning, right? Those things that go beyond regular expression and pattern matching specifically. There's this thing now that's called Big ID. And what Big ID is, it's a data intelligence platform solution, that kind of helps you navigate to take action on data, patient information relative to health IT. More importantly, what it does is it helps you really discover and how to map, tag, catalog, and take action on patient information. That to me is going to take the cybersecurity aspect to the next level. In my mind, it doesn't matter what kind of data it is too across the enterprise. That doesn't matter. It can be on-prem, it can be in the cloud, structured, unstructured, at rest. It doesn't matter, but it helps you really classify, manage, and protect the data, yet just beyond compliance requirements. So some of the things in my mind for AI in particular is shaping, like I said, next generation machine learning, having a well-trained team. Because again, AI is a great buzzword. It's a great term. A lot of people want to use it. They don't understand that you have to have internal policies pretty much set up. You have to have a well-trained staff for cybersecurity specialists, pen testers, ethical hackers. All of those things need to be in play. So in my mind, AI is reshaping cybersecurity in the health IT space. And I think that with more next generation ML, next generation AI, and helping people really understand that you actually have to protect at the grassroots level. The compliances are there, they're everywhere. However, it's disingenuous of us to sit down there and say we know what other compliances, regulation and compliances need to be there. High tech, high trust, Gina, they have a series of those right now. But AI, I think, certainly is going to reshape cyber and health IT space in the future.
So again, a lot of what Eric spoke to, I won't go through in grandiose detail, but on what regulatory changes are needed. We talked about, or Eric talked about, the data protection standards and looking at IoT, looking at AI. How are those standards going to change with evolving technologies? Talked a little bit about the various compliance frameworks being HIPAA, high-tech, GDPR, and is there an opportunity to align those and have a more cohesive framework instead of trying to chase the many rabbits that exist today? There's also the element of incident reporting, both internally, what is an incident? What are the reporting requirements? Who does that go to? What visibility is there? Third-party oversight. Third parties could be software vendors, could be medical device vendors, and I'll talk a little bit more about that on what the Department of Defense is doing in that regard. Workforce training, and also funding. I think funding is a huge element. I think we will continue to be challenged with the unfunded mandates, especially. I know many healthcare organizations are still recovering from the effects of COVID and recovering from those losses. And one opportunity that there could be, not just funding, but there could be, is there a cost avoidance opportunity with cyber with cyber insurance carriers, and if you implement specific technologies, is there an opportunity to reduce the liability or reduce the cost of said insurance? So one thing that that we're dealing with, because we are a vendor providing service to DoD organizations, is new legislation, and many may be aware, but quickly, is CMMC, and that's the Cybersecurity Maturity Model Certification, and that just speaks to a little bit of the third-party oversight. So within the next year or so, we as a vendor will need to be either, there's 3 different levels. There's level 1, level 2, level 3, 17 controls for level 1, 110 for level 2, and very higher level advanced controls for level 3. And basically that is a requirement for us as a vendor to even bid and or do government work with the DoD. So, and I know that HHS is keeping an eye on that. And are there elements of CMMC that could roll over and flow over into CMS and other agencies of HHS? And one other element that I want to speak to that we deal with is what we call the ATO process, which is the authorization to operate. So it is a very detailed process for technologies, could be medical devices that connect to the network, and or software solutions that connect to the network and have access to controlled unclassified information, CUI, and a laborious process for that. So that is something that could flow into the commercial markets as well, is what are those vendor requirements to house PHI and to connect to the network, and not just a one-time certification, but also the management of the security posture thereof. So those are some elements, but I think a big one would be, again, I don't know as healthcare is ready for yet another unfunded mandate. I think that funding is a key requirement to really make progress. And that's all. So back to you, Anna.
Thank you, Clay. Very informative. So our final panel question for today is, how can organizations balance innovation and security in health IT? And I'll address this question to Barbara.
Again, I think, from our vantage point, we're doing a lot of auditing, right, on the back end across the enterprise. So that auditing can consist of PCI DSS, which is more credit card driven. There are a lot of IT health organizations that are depending on fees for revenue. There are health clinicians and health advisors that use very large data banks to manipulate license and evaluate future physicians and clinicians. They have to pay a fee every time they do a query, right? So that fee allows some of these organizations to survive because those fees are revenue based. The innovation, in my mind, for some of this stuff, again, centers around understanding we do have to have great and strong cybersecurity policies in place for security and IT health, just across the spectrum in general. Again, a lot of basic things start with just training, internal training. There are virtual nursing now. There's virtual sitting now. That we talked about the Internet of Things. There's also the Internet of Everything, right? Where we have all kind of devices, pressure monitors. We have watches now for health. So we're balancing a lot of innovation, but one of the things that we have to understand about innovation and security and health in particular is legacy applications. Those things that are on-prem, they're not scalable, right? They're not things that we can really scale from, and it costs a lot to maintain those legacy applications. So you can have all the tools in the world, you can have all the innovation in the world, these organizations and how they balance it, whether that's, telework isn't going anywhere, VPN just doesn't allow you to see what employees and users are doing specifically. So a lot of compliances are in place for this reason, to try to help balance some of the innovation and the security that's necessary on the risk management side, protocol, on the authority to operate side of the house. There's actually authority to operate innovation out there right now that actually returns over 120 controls in terms of results. And you don't really have to go out and do that research any longer. So the innovation is out there. The problem is organizations, they really do have to balance their security posture with policies and procedures first, making sure that you're innovating from that standpoint against solid policy, against solid practices, and that you understand, what security measures need to be in place, and even those that are beyond the compliances. So in my mind, that's really what I wanted to offer in that regard.
Thank you so much, Barbara. I appreciate everybody's participation today. If you do not have a question at this moment, but would like to reach out and ask questions after the webinar, please, you can email me. You can email somebody on the team and submit your question, and we will also address it and follow up. I would like to let everybody know that we will continue to have our series of webinars. And in 2025, we will also have a series of in-person, not just webinars, but also in-person that focuses on health and everything health IT. So we continue to build our presence and also build our community. And we appreciate you participating and being involved with our innovations and our discussions. Once again, please follow us on social media. We will post this presentation on YouTube. We will also link it to back to LinkedIn. So you will be able to find it on LinkedIn, on YouTube. We also have Twitter, a presence. So please feel free to reach out to us. Feel free to email me. If you would like to also be a participant in a future webinar, please let me know as well. Thank you, everybody. I would like to thank our panel, and I would like to thank everybody that has listened in on our conversation today. Have a good day.